A regimen of taking up to 8 pills a day.
And then this is the Percocet.
It's all to fight the chronic pain.
This is here the Nicenta. This is a ER, which means extended release.
Of constantly passing kidney stones.
I would give birth every single hour of every single day instead of passing another stone.
Jessica Reitzel is in her 30s and in pain every day. She was diagnosed with medullary sponge kidney disease after passing 20 kidney stones by the time she was 17. Thanks to prescription opioids, she can live a relatively normal life.
It's because I know that if I didn't have the medication in me right now, that it would be even worse than it is right now. This wouldn't be happening right now. I'd be in my bedroom laying there curled up in a ball trying to deal with the pain.
How did we get to where we are now? In the 1990s, doctors became more willing to prescribe opioids, and this continued into the 2000s. Then, ER visits because of prescription opioids dramatically increased. Fast forward to 2016, and more than 42,000 people died that year from opioid drug overdoses. Now, there's a crackdown to try and reverse the epidemic. A CDC guideline says doctors should be more careful of prescribing more than 50 morphine milligram equivalents a day. If doctors are prescribing more than 90 MME, they should justify that decision.
But the other opioid crisis is patients who legitimately need the medicines, and they are legitimate medicines, not having access to them.
Dr. Robert Hansen has been treating pain patients for 30 years.
Pain has become much more complicated. It's become frightening for doctors, and more are getting out of it, including pain doctors.
There are steps doctors can take to make sure their patients don't abuse the system. Pain patients see their doctors very often, thank you, get their urine checked every doctor's visit, and get their pills counted, among other ways of checking opioid use.
Reasonable doses or modest doses are not being prescribed because people are afraid to do so. Doctors are afraid of some kind of action being taken against them.
But Reitzel and Dr. Hansen say this is a painful solution to the problem, and the people hurting most are patients. Law-abiding patients will suffer in pain, will turn to the street to illegally buy medication or heroin. Then there's the third group.
We are seeing more and more of this who simply say, you know, I can't do this anymore, and they end their lives.
We've got to, as a country, got to come together and understand that the problem isn't the medicine, it's the people who are taking the medicine. If they need the medicine, that's fine. But if they don't, then there's no reason why they should have it.
I'm Kim Kung, News 3.